Hey, good morning. Well, good morning for me, as you can see. For you, might not be good morning, it might be good evening when you watch this. Anyway, welcome to the first of many, many parts of series. This is the medical terminology part one. I'm gonna try to make this pretty quick. I'll probably in the middle of it add some additional terms just to help you out. Anyway, so if you arrive here, that means this must either be your first time taking medical terminology or you simply just trying to catch up. Or maybe you've done this quite a while ago and you're trying to brush up on it. In any case, let's get going. This only has 19 slides, but it contains a lot of information. Luckily for you, it's a video, so you can pause it whenever you want. It's not like sitting in class where you might feel some type of way when it comes down to raise your hand or something. Anyway, so what is medical terminology? Medical terminology is essentially, well, most of it is really Latin. Um, and that's what makes it kind of difficult because really it's as if you were writing or trying to learn a completely new language. But it is extremely helpful. Um, it's probably one of the most helpful items you want to start off with when you start looking into doing anything medically related. Even for those who are not going to be practitioners, who are not going to be nurses, who are not going to be nurse practitioners, LPN, CNAs. As long as you're doing something medically related, I think it's important to have at least a decent understanding of what medical terminology is. So, well, let's get going. All right. So when you start working on medical terminology, there are essentially two items, well, not two, three major items that you want to look at. You want to look at your root word, your suffix, and your prefix. Alright, so let me crack open this slideshow here. And from the beginning, since you're already in the beginning anyway. I typically don't like slideshows because they always seem boring. It seems like there's no interaction or something, but we'll try to make this one as exciting as possible. No promises though. Anyway, so this is a basic example of what a medical terminology can be like. Right. So at the front you have the root word, which is suffix cardi, a combining form, which is for the most part is going to be a O. And what that does is it simplifies the terminology. It lets you know where the two terms or three terms are coming together, and it makes pronunciation of words much easier. And then you have a suffix, something that a term you may already be familiar with. A suffix is a term that comes at the end of the word. And then you have a prefix, which will come in the very beginning, hence pre. So let's build this few words together here. Right. So what are some of the common root words that you're going to run into? Before we go into the common root words, let's take back a look at this here. So we have cardi. Cardi is the root word. We have ology as a suffix. So if you were to combine these two together, essentially what you have is cardiology, study of the heart, right? So that's all medical terminology is. In the beginning, it seems rough because the words you either have never seen the words before, or, you know, maybe you saw them quite a while ago and you're not familiar. But otherwise, it's pretty simple um, class, I think. So these are some of the most common root words that you're going to run into. And again, as we go by, I'll probably add a few additional terms just to reinforce. Not to mention when you start taking the test also, or the quizzes, I should say. Not test. Test always sounds like a bad word. The quizzes. When you start taking the quizzes, you can, you want to use some of these words. All right, so gastra. You probably heard of something that sounds like gastro related, right? Somebody going to see a gastrologist or something of that nature. So in that case, you're dealing with a stomach. Cardi, which you already just ran into, would be heart. Myel. Alright, now I put these two together, myel and my, because oftentimes students get these two confused. Right, when you talk about myel, you refer to um, the spinal cord or the bone marrow, whereas my, you are referring to a muscle. Alright, oste. Alright, oste, you've probably seen this before somewhere. Someone has osteoporosis. Right, what does osteoporosis talk about? It talks about bones, right? Somebody with holes, literally holes in their bones, right? Nerve is for your nerves, right? If you're talking to someone going to a neurologist, right? Somebody's going to see a nerve specialist. Arthra is for joint. And the word sites or site E here will be for a cell. Don't you like the arrow going right across? It looks very fancy. Anyway, nephra, right? Nephra is your kidney. Hepat, think of hepatitis, right? It affects people. Well, I shouldn't say people with. It's going to say people that drink, but you don't have to drink to have hepatitis. Anyway, hepat, all right. Liver, palm, all right. Think of somebody say you're going to a pulmonologist, or maybe you haven't heard somebody going to a pulmonologist, or maybe you've heard of the pulmonary system, right? That means you're talking about the lungs. The lungs and associated characteristics. Anyway, Ryan or Nas for your nose. Ped, ped and man. These are the ones that students always catch up to very quickly because you've probably heard somebody going to the to get a pedicure, right? What is a pedicure for? It's for your feet, right? And what is a manicure for? For your hands. So very easy to remember ped and man. Derm, right? Dermatologist. Let me move this cursor around. I don't like it blanking on the side like that. There you go. Carp, right? You've probably heard somebody with a carpal tunnel syndrome, right? So that means you're talking about the wrist. Cervic, do not confuse that with cervix. Right? Cervic, you are talking about the neck. You might hear somebody say, "Yeah, I fractured my cervical vertebrae," which you probably don't want to hear somebody say that. They may actually not be able to say that if they have fractured that, because they may be paralyzed. Yeah, so not something you want to hear. Anyway, so a combining form. What is the purpose of a combining form? Now you notice I kind of ended the root words already, but as I said before, I'm going to add more as we get towards the end of this. What is the purpose of a combining form? It simply, as I said before, it makes the pronunciation much easier. For instance, let's say you have a suffix, right? And the suffix begins with a consonant, right? Right. If the suffix begins with a consonant, meaning it is not a vowel, and you don't know what vowels are. A, E, I, O, U, right? A, E, I, O, U, sometimes Y. A suffix, simply what it does is going to give us further explanation as to what's happening with the root word. So if you wanted to combine a suffix, but the suffix itself began with a consonant, as in this case here, P, all right? Imagine you say neuroplasty. Neuroplasty. Now, if you say it quickly enough, it probably doesn't sound so bad. But neuroplasty sounds much, much better. Not to mention with neuroplasty, you're able to distinguish where the root word ends at the R and where the suffix begins at the P. So that is the whole function here of what a combining form is supposed to be doing for you. And again, the vowels that you're going to see, A, E, I, O, U, if that was the beginning of the suffix, then we would no longer need a combining form, right? Because you're not making your pronunciation any easier by having two vowels, right? So let's look at something like this, right? We have two root words that are joined together, right? The first root word begins with ends with R. The second root word begins with an E, right? Here, what you want to do is you want to put a combining form in between, right? So that we can distinguish where this ends and where this begins. Gastroenteritis, right? With this suffix, the itis, which simply means inflammation, right? The suffix already begins with an I, which is a vowel, right? So there is no need to put an O here. This is a root word, this is a root word. When you have two root words together, what you do is you combine them with a combining form. In our case, our combining form, as we already determined, is an O. So, gastroenteritis. Again, we do not need an O here because that means that does not make pronunciation much easier. Imagine trying to say and to oitis. That actually makes the pronunciation much more complicated than it needs to be. Right, so that is the excuse me, whole purpose of maybe I should take some water. Anyway, that is the whole purpose of the combining form. All right. Suffixes. All right. So again, this would be a list of some suffixes, but we will talk more about suffixes, and I'll give you more, much more when we get to the end. But these are some common ones. So in the beginning here, we have some root words. Cardi, which you already met in the root word sample, right? ACUMAL. Alright, all these are suffixes, and all they simply mean is, all they simply mean is pertaining to. So whether you say cardiac, cardium, cardio, you have not changed the very definition of the word. The very definition of the word is cardi, which is heart. All this means is pertaining to heart, pertaining to heart, pertaining to heart. So it just depends on the context of the sentence, right, and what you're trying to convey to your reader. You may use cardio, cardium, or cardiac for the full of the whichever sentence you have. All right, so here are some common suffixes that you're going to run into. Osis and isis. All right, they essentially mean the same thing here. It means abnormal condition, right, or condition. Algia, or algia, right? It's pain, pain. Itis, which is the one that I think most people know, even without actually ever touching the medical terminology. They often know this one. Itis is just an inflammation. Malaysia means softening, right? And conversely, you can also have sclerosis, which will be hardening. Magli, this one is always easy for people to remember because remember mega. I'm sure we all want to win the Mega Million someday. But in case you never get a chance to win the Mega Million, you have to just continue watching this slides there. Anyway, so Magli or Mega, right? Think of Mega, Megaly, Magli, right? Enlargement. Necrosis, right? Tissue death. Right? Something is necrotic, that means that thing is dying. Hopefully it is. No, never mind. I'm not gonna make those very dark jokes. Anyway, more suffixes for you here. Stenosis. Right? Stenosis is a narrowing. Right? You're gonna see this a lot with when we start talking about arteries, arterial stenosis, and things like that. When the lumen or the very interior, the lining of the artery begins to narrow. Oma. Right? Oma is a benign tumor. Right? It's a benign tumor. Although you are going to find a few tumors that will have the word oma in it, which is, I didn't come up with these things, so I cannot be blamed for them. Phobia, right? Phobia is a fear, but specifically it's an abnormal fear. For instance, one of the things I always say is if you are, let's say, watching the TV and there's a snake passing through the TV, and you have a fear of this thing. It's fine. Maybe you don't like snakes or something like that. But for you to jump up and run when when a snake is on the TV, that's abnormal. Because the possibility of that snake coming through the TV to come and get you, that's a little bit far-fetched. Understatement. Yes. So yeah, you. On the other hand, if you actually saw a physical snake and you ran because you were afraid it was going to bite you, then I wouldn't say it's abnormal, because there is the possibility that snake may slither and come get you. So I'm sorry if you don't like snakes, this talk here is probably not helping you out. So let's move on. Centesis, a puncture to remove fluid. Right, puncture to remove fluid. We'll talk more about that later. Graphy and gram, these are put together because they go together. Graphy is the process of recording something. So electrocardiography, right? EKG or ECG. You are recording, electrically recording not electrically recording. Of course, you record it. You're recording the electrical activity in the heart. Whereas the gram will be the actual paper that you've recorded on, or the actual X-ray that you can hold in your hand. That is the gram. Ng refers to blood vessels, both Well, not both, all three blood vessels. And plasty, right? Plasty is the surgical repair, and scopy is the visual examination, right? Hey, what is that? Is that my phone right here? That is my phone right here. Sorry, that's kind of rude. I tell my students not to have their cell phone on, so that was rude of me. You won't hear that again, or maybe you will, unless it's not on vibrate. Mm, now it's on vibrate. Alright, so here's some more common suffixes. Now let's go back here. We said scopy, but we didn't say scope. So let's add scope in here so that scope might actually be in there somewhere. But since you already had scope, you might as well add scope onto the list here. Hey, where is my? Come on, okay. It's gonna say where's my bullet? I don't like when it doesn't give me my bullet. There you go. Alright, so if you have Scopy as a visual examination, then Scope will be the actual tool that you use for your examination. So let's return back here. Hey, where's my slide? Let's go back to our big pictures. Alright, so ology. Ology and ologist. I should have probably added ologist to the list as well for you too. But anyway, it's not on here for now, so we'll only talk about the things that we have. So what is an ologist? Ologist would be the specialist, right? Whereas ology, right? Ology would be the study of. So if you talk about first thing we talked about, that was the cardiology, that was the study of the heart. So cardiologist will obviously be the specialist of the heart. Classes, kind of similar to Tripsy also. Classes is when you break, alright, you break something, alright, surgical fracture or break. Let's say osteoclasis, right? Surgically fracture a bone. Maybe the bone has some sort of deformity and you wanted to make some correction. Tripsy is also similar. Tripsy when you break something, also tripsy. Typically though, when we talk about tripsy, you might say something like lithotripsy, right? Breaking stones, right? Lithotripsy. Anyway, pexy. Right? Pexy is a surgical fixation, right? Surgical fixation. That is pexy. Now, I lost my lysis. Lysis is when you separate something, right? When you separate. Metry is measurement, which goes along also with meter, right? Metry and meter, right? Both measurements. Okay, let's go on. More suffixes. I gave you a lot more suffixes than I gave you of the root words, I think, and the prefix. Prefix is not too many prefixes. And typically prefixes are very, very simple and easy for students to catch on to. Anemia. When we talk about anemia, we're talking about blood condition and blood condition. Genesis. The Genesis, as you can probably know from the Bible, if you read the Bible, or if you've heard of the Bible. Genesis is the first chapter. Genesis talks about creation, so that's what it is. Genesis is creation or the start. Lith, again, stone. I think I mentioned that already. If I didn't, stone. So you can have kidney stones and gallstones, things like that. Pathy or path. Right, talk about disease. So when we talk about pathology, we're talking about the study of diseases. Penia, not to be confused with penis. For some reason, students always look, erase that A and somehow magically put their own S at the end of it. But penia is just a decreased, right? Decreased. Phagia, right? Hunger. And once again, phobia, which is repeated twice. I wonder why. Anyway, phobia once again is fear, or as I said before, abnormal fear. Okay. I clicked and it didn't go anywhere. I thought maybe that was the end of it. So, more suffixes. It looks like I won't have to give you more suffixes later because I'm giving it to you all now. Plasma, trophy, ptosis, and toxic. Plasma is formation. Right? Plasma is formation. Ptosis, drooping, and toxic is exactly what it sounds like, something that is a poison. Trophy is nourishment, right? Nourishment. So if you have atrophy, that means you have lack of nourishment. So here are some suffixes that are more of an adjective term, and we talked about some already. So if you have a word like, let's say, pulmonary, right? The airy part of it is the adjective that makes the pronunciation much easier. Um, Ill, as in esophageal, or ick, which we kind of mentioned already, as in anemic or cardiac, things like that. Ical, as in ileocecal, right? Uh, Ile, penile, IO as in inferior or superior. Um, IOR, also infectious, OUS, which you're going to see a lot. US and OUS, these are some of the biggest um, suffixes that you're going to see. Infectious. Tick, as in acoustic. Right? So those are some adjective suffixes. Some noun suffixes. IA as in bacteria. Right? Ism, right? As in animism is just an example. Iatry as in psychiatry or physiatry, things like that. Dietitian, right? The Asian part. Right? So these here mostly identify a specialist or identifies a specialty of some sort. Ist, optometrist, or we talked about path already, pathy, the Y. Alright, so these are some noun suffixes. Some commonly confused ones. Right, these are basically ones that I find students get misplaced a lot. The double R's, Raja and rage, which are the same thing. They mean bleeding or excessive bleeding. Let's say excessive. Yeah, excessive. Okay. Rafi, which is a suture, right? Surgical suture. All right. Rhea, which is flow. If you heard of diarrhea, which I'm sure if you are, well, I'm sure in any case you've heard of diarrhea, regardless of your discipline. Rexus, right? A rupture. All right. So here we have a 1, 2, 3, 4. Right? These are the double R's that a lot of times students get confused with. And these ones also get confused a lot, especially these two, ostomy and otomy. Right? Ostomy with the S is the surgical creation of a hole. Otomy is when you surgically make a cut or an incision. Right? So always think that the extra S here is for a hole. I'm not gonna make a joke about that. And ectomy here is for a removal, a surgical removal. Prefixes. These tend to be students' favorite because for some reason either they are very simple or something. I don't know what it is, but they're very easy, I suppose. Pre, right? Pre is before. Pre-game, right? Whereas post to be post-game, so after, right? Peri is during or surrounding the event, right? So let's say if you say something like menopausal, right? That would be around the time of your menopause, right? New. So if you say neonatal or neonate, right, you're talking about newborn or yeah, newborn. Endo, the inside, right? Ab and ad, right? These are very simple ones here. Let me run that. So let's say if you say something like abnormal, right? When you say something like abnormal, it means that it's away from normal, right? So that would be ab, right? Away. Whereas add, you can simply put another D to it. When you add something, you put something towards it. Alright, so add, or in another word, you can also use in addition, right? All both meaning something towards. So, very, very easy concept. Hyper and hypo, very easy ones for people to remember. If you say hypertension, right? That means you're referring to increased, right? If you say hypo, that means you are talking about decrease. So hypertension and hypotension, increased and decreased of each other. Let's see. Go to the next one without moving, so that maybe if I need some addition, I can type them. These two here often get confused with each other here. Inter and intra. Alright. Let's say if you have intercostal. Alright. That means you're talking about in between. Right? In between the ribs. Right? Whereas if you were to say, oh, let me get back my R. Let's say if you were to say intra, you'd be saying intracoastal. You'll be saying that inside, right? Inside the ribs. Sub. Easy way to remember this is submarine, I suppose, right? Submarine. Submarine. Alright, so below the marina in this case, right? So below, sub will be below. Come on. Whereas supre or super, you can say either way. You can say, come on, give me my cursor. I said give me my cursor. Let's go back there. Hey, what happened there? Okay. Oh wow, I think we lost some of the terms in there. That's what happened. Okay, anyway. Super or supre above. Dys, dis, right? Dysfunctional. Think of the word dysfunctional. Alright, here though, we're talking about pain, sometimes pain or, let's say for instance, we have this urea, painful urination, or difficult urination, right? EU, good. I always like EU for some reason. EU is good. Retro, back. And then here are some numbered terms here. Bi or diplet, right? This is 2. Right? This is specifically 2. Let's go to the next one here. Oh wow, we already at slide 16. That means you're almost done. Alright, hemi, half, right? Macro, and micro. Macroeconomics, right? If you talk about macroeconomics, you're talking about the. Well, why do we talk about economics? It's not economics class, it's math related. But anyway, large and micro would be small. Mono, meaning one. Also uni, right? One. Multi, many. Poly. Don't confuse this poly with poly, which is gray. That means gray. Right? Poly means many. Poly is gray, and polis, as in metropolis, city, right? Let's try it. Let's have a little fun here. Necropolis, city of the dead. Yeah, how you like that? This one here. More suffixes. It looks like I'm gonna have to give you more of the root words because I gave you a lot more suffixes and all of these things. Yeah, I did. Anyway, more prefixes. Primi, right? First. Right, I am first. Quadro, 4, tree, tri, tree. That's it. Tri, tree, 3. Yeah. Circum, around. Right, to circumnavigate something, to be around that thing. Dia, through, as in diarrhea, through flow. Doesn't sound so good when you explain it. Brady, slow, tacky, fast. So if you have, let's say, Brady cardia. Oh, that got too small, so you probably can't see much now. Brady cardia would be very slow heartbeat, whereas tachycardia would be fast heartbeat. Anti would be something that's against, right? As an antimicrobial. Antimicrobial. Let's take that off so you can actually see it. Antimicrobial. Yep, antimicrobial. And what do we have next? Some more prefixes. Homo, mal, pan, pseudo, and sin. What is that? Never seen that before. I'm just kidding. Do not confuse homo with heme. Alright? Please do not confuse homo with heme. I've seen this happen a few times. Mal is bad. Alright? And pan. Pan is around. Right? As in if you say something like pandemic. Right? Pandemic. What else we have here? Pseudo, false. Right? Pseudo is false. What else? We have sin, as in syntax. No. Sin as in what's the word I'm looking for? Symbiotic. Union, together, right? And wait, did I say what home was already? Same. Same. Right? As in the same. As in, if you get something homographed, right? That means transplant from your um, transplant, homograph, same transplant. Let's see. I think that is it. So I will see you in part two. The good thing about this is a video. You can rewind it. Well, yeah, you can go backwards. You can't rewind it because it's not really an actual DVD or tape. So just go back and catch the rest of it. See you next time. Bye bye.